Thank you, and good morning from Oakland, California. My name is Lisa Chen, and I work for ChangeLab Solutions, and we're pleased to present today's webinar, the first in our series, presented in partnership with the Network for a Healthy California. And today's webinar is on PSE 101, Building Healthy Communities Through Policy, Systems, and Environmental Change. We're really excited to hear about your experiences and to start to talk about some of the PSE approaches that might work in your settings. So before we dive in, I just wanted to introduce myself and my co-presenter, Christine Fry. Christine Fry is a Senior Policy Analyst and Program Director with ChangeLab Solutions, and she has expertise on a whole range of policies. Notably, she's our in-house expert on federal food policy issues, including the Farm Bill, and is a co-founder of the Healthy Farms, Healthy People Coalition. And she's also got a great wealth of expertise on food retail and restaurant nutrition policies. I am an urban planner on staff, specializing in local and regional level planning and economic development policies to support community food systems, active transportation, and sustainable neighborhoods. I'm also, in a former life, I worked for the Network for a Healthy California as a contractor doing garden-based nutrition education at an urban agriculture nonprofit in San Francisco. So for those of you who are not familiar with our nonprofit organization, ChangeLab Solutions, we're a team of lawyers, urban planners, and policy analysts who partner with communities to improve health. We do this through trainings, technical assistance, model policies, and research that helps communities build their capacity to create policies that enact social change. And I mentioned this before, but we also want to just acknowledge and appreciate the Network for a Healthy California, who has asked us to co-present this series with them and have a whole range of expertise and resources available at your disposal. So here's the agenda for today's program. Today we're really going to be diving into what a PSE approach entails. So we'll be defining that. And then we're going to step into a frame that we call the 8 essential elements of a strong prevention strategy, which overlaps quite nicely with a PSE approach. And we'll be discussing a range of case studies and examples from around the country of communities that have successfully used PSE. And then at the very end we'll have some time for a discussion and question and answer. So today we'll start out by really exploring what a PSE approach entails. And just to make sure we're on the same page, we're really going to unpack a couple examples that illustrate the definition of P, S, and E. So first off, why are we focused on a PSE approach? Fresno, California provides a great example of why this is so critical. So imagine this. The city of Fresno lies within one of the world's most productive agricultural regions. Yet until recently, there was barely a farmer's market in sight, so people could not access this bounty of fruits and vegetables grown nearby. How could this happen? Well, as it turns out, Fresno's zoning code, which determines how land and spaces are used throughout the city, didn't define farmers markets as an allowable use. So getting approved to establish one was nearly impossible. So they started with a policy. As part of a Fresno Green Sustainability Strategy launched on Earth Day of 2007, a group of advocates and policymakers worked together to amend the zoning code to define farmers markets and allow them in commercial and residential zones, thus creating an opportunity for fresh produce to be made available in neighborhoods around the city. As an added benefit, the new rules created more economic opportunities for small local farmers, many of whom had to travel to the Bay Area to sell their produce. Now that the Fresno policy is more permissive, the hope is that this will encourage local farmers to stay closer to home and sell in the region. So the policy change then led to a change in systems as the city created a process for people to apply for and develop farmers markets. And finally, this led to an environmental change. By amending the zoning code, the city created an environment that is conducive to making the healthy choice the easy choice. The city of Fresno made it possible for farmers markets to sprout up and flourish all around the city. In this example, the policy, systems, and environmental changes all work together to create greater access to healthy food for those who need it most. We can all easily imagine what kinds of program activities could complement this approach to create a holistic strategy for change. For example, Harvest of the Month curriculum could be used in schools. There could be nutrition education at senior centers. There could be cooking classes at WIC offices, fresh produce prescriptions in local clinics, and more.
Hi everyone, this is Christine, Lisa's co-presenter, so I'm going to pick up from here for a little bit. Before we get too far into the presentation, let's take a step back and look at how we're defining policy, systems, and environmental change. So policy, when we're talking about policy, we're talking about a written statement of an organizational or agency position, a decision, or a course of action. So things like ordinances and resolutions, that sort of thing. Systems change, we're talking about changes to organizational procedures, like personnel allocations, money or financial allocations, and programs. And finally, when we talk about environmental change, we're talking about physical, observable changes in the built environment, in the economic environment or social environment of a community. And this webinar is kicking off a whole series where we're really going to explore what each of these P, S, and E look like in a variety of different issue areas, from the physical activity side to the food side. Now, from what we understand, systems and environmental changes might be something that you all are more familiar with. So we wanted to focus a little bit on policy. So as we said before, policy it should be a statement in writing. It should be binding, and it should set out a general approach that's applied broadly. The policies tend to set the context for widespread change. They create conditions in which other system and environmental changes and even policy changes, both in the public sector and the private sector, can emerge and flourish. Now some people like more definitions by examples. So here's what we're talking about when we're talking about policy. We're talking about things like local ordinances, state or federal laws, resolutions, which might express the will of a legislative body, school or agency policy language, even contracts and agreements. They're written down, they're binding, and they talk about how a particular program or issue is going to be worked out. So now we're going to go through some examples of policy, system, and environmental change in different issue areas. So let's start off with getting healthy vending machines into different types of institutions. So Lisa, join me here. What is a policy that might make healthy vending machines happen in a government agency?
Sure. A government agency could create a vending policy that requires that a minimum proportion of food sold in vending machines meet nutritional standards. This is actually a policy that is also great for other institutions, such as companies and businesses.
How about a system change?
Well, once the policy is in place, or really even before the policy gets passed, you'll need to work with your vending operators and your distributors to think about how you can start to introduce those healthier products.
And environmental change?
So concurrent with all of these changes, a health group could think about how to market the changes by creating materials, doing demos, and having other sort of promotional activities to inform customers about the change.
All right, let's try something else. How about urban agriculture? What's a policy that could promote urban agriculture?
Sure. So a community might change their zoning policy so that people who are working in urban agriculture can now sell the produce on site.
What about a system change?
So a lot of communities are having issues connecting urban farms with resources. So a city could work with their utilities departments to make sure that water and other utilities are available.
And then what's the environmental change?
Well, here's where the shovel hits the dirt, and really the change is what the urban agriculture advocates create, the new gardens.
Cool. What about farm to school? What's the policy that could create farm to school initiatives?
So local stakeholders and partners could work on a wellness policy that directs the district's nutrition services to increase the purchase of local produce.
What's a system change?
That could mean conducting an inventory of current purchasing practices that will allow this group to start to identify foods that are available to purchase.
And then what's the environmental change?
That could include a salad bar that could display produce and include other marketing techniques to promote the new menu items to students. Great. So this is Lisa again. So those were great examples, Christine. Really, I think that you can imagine that in any setting or any type of community space you're working in, there's a range of P, S, and E approaches that can have an impact on health. We just wanted to mention that even small incremental steps that build towards changes really can have an impact on preventing obesity and other chronic diseases. According to a 2012 study by Wong, Orleans, and Gortmaker in the American Journal of Preventive Medicine, they found that in order to reduce the obesity epidemic, we need to reduce the average American diet by 64 calories or more. PSE approaches really can have a critical role in this effort. As many of you know, earlier this year, the Institute of Medicine released a report on accelerating progress in obesity prevention, outlining 5 strategies that could have a big impact on preventing obesity. Their suggestions, which are integrating physical activity in daily life, creating healthier workplaces and medical settings, strengthening school environments, increasing food access, and promoting healthy eating, are very compatible with PSE approaches. So that was a very sweeping introduction into what PSE entails. And before we dive into some case studies, we want to hear from you. So we have a chat box that you should see on the left-hand side of your screen. And the question that we have for you is, now that we've defined what P, S, and E are, what is one policy idea that you can think of that would support your current nutrition and physical activity education efforts? So please take a second to think about it and type it in the chat box on the left-hand side of your screen. There's some examples listed here. All right, we see soda tax as an example. So let's think there's folks on the call who are working in schools, in school districts, people working with faith-based institutions. Oh, here's some other ones. Healthy vending machines in schools, specifically ones that policies that promote zero sugary drinks. Subsidies for healthy food, school district policies to increase the consumption of fruits and vegetables. Oh, there's tons of ideas coming in now. Water stations, working with local restaurants, mobile vending, recreational departments, zoning codes. EBT acceptance at farmers markets, joint use agreements. This is great. It sounds like people on the call have a lot of ideas already about what types of P, S, and E approaches can really support their work. tobacco-free workplace, that's the final one. County wellness policies for county businesses. Great. So we're going to move on and start to think about what elements make a strong PSE approach. So this is a frame that we've created kind of building on the years of experience that we have working in the field of healthy community policies. So our obesity prevention team has been providing legal and policy technical assistance to obesity prevention advocates and policymakers around the country. And so we took a step back in the last few years to articulate some of the lessons that we've learned through this process. So we distilled it into these 8 essential elements of a strong prevention strategy, which we'll be describing step by step. So the first element is, I think, something that really appeals to people who come from a public health background. Any obesity prevention strategy or health prevention strategy needs to start with data and make sure that it's grounded in community. So I think, as many people who have worked with policymakers can attest, local policymakers really want local context-sensitive data. In the midst of competing priorities and scarce resources, compelling data on health opportunities and challenges really can help them make the case for why they should stand behind policies that promote health. Though data collection can be very resource intensive, luckily you have a number of fantastic resources available to you through the network. And one of the best data collection instruments to assess the food environment is CX3, Communities of Excellence in Nutrition, Physical Activity, and Obesity Prevention. This tool asks questions like, are there healthy food choices available and accessible to residents of low-income neighborhoods? How many fast food outlets are there in the neighborhood and around schools? What is the proportion to large grocery stores? How much and what are the types of nutrition marketing messages around schools and at stores? Can you safely walk to the store? Is it accessible? And there are many other metrics as part of this tool. So just to give you an example of a community that's taken this tool and then put it into practice, in Sonoma County, the local health department has created a recognition program for store owners who scored above 75 points on the CX3 scale. The Board of Supervisors is starting a recognition program to honor a new crop of stores this year who have made healthy changes. Another great example from the network is in San Bernardino. So in addition to working with existing assessment tools, you may find that you need additional information on community needs, barriers, and opportunities. Community partners can really play a key role here, extending your reach and building buy-in for PSE changes. So with the support of the Network for Healthy California, a team of residents, health department staff, community-based organizations, faith-based organizations, and schools developed the California Gardens Neighborhood Cluster Association Community Collaborative to work on restoring the health and safety of West Side San Bernardino. So they did this in-depth assessment of health, safety, and neighborhood beautification issues in the community, which included over 300 one-on-one interviews with local residents and held a series of summits at local community facilities that were attended by really diverse partners. In addition to the partners who are part of the association, they had nonprofit, community, and business partners. So some of the outcomes of this work that they've built over time are that they are now hosting a farmer's market at a local community center. They have a community walking club. They have a beautification day, and a community garden, which has now enrolled local residents who are growing their own food. So with that, I'm going to turn it over to Christine for the next element.
So a strong prevention strategy should be ambitious but politically feasible. And this is a classic dilemma that every community faces. Let's go to Columbia, Missouri, where they have really tackled this challenge quite well through their Safe Routes to School work. They have one of the strongest Safe Routes to School initiatives in the country. Safe Routes to School programs build capacity to improve the biking and walking conditions around schools through what they call the 5 E's: evaluation, engineering, education, encouragement, and enforcement. And throughout all of those are policy changes, systems changes, and environmental changes. A local advocacy group really has led these efforts. It's called PEDNet Coalition, and they work on Safe Routes to School as well as other efforts to improve bicycle and pedestrian access through the city, which is really a key component of Safe Routes to Schools. They apply 2 distinct methods to their work. They often start an initiative to improve walking and biking for kids who are trying to get to and from school with programs that encourage behavior change, that build demand for safer routes to school. So they do things like walking school buses, bike and walk to school weeks, and social marketing campaigns that promote using bikes and walking to get around town. These programs also help them build relationships, not just with schools, but with other really great community partners like hospitals, nonprofits, and community groups. Once they've built demand for biking and walking, then they switch to advocacy while maintaining those same programs. So they might advocate for policies that result in improved infrastructure. They educate policymakers about the benefits of a more walkable community and making it safer for kids to walk and bike to school. And they really harness that excitement that they've generated through walk-to-school days and walking school buses to support their policy proposals. And PEDNet has been incredibly successful over the past few decades because they have been realistic about the path to change. They haven't started with really strong policies and tried to get them passed without first building up demand for them through their environmental change and programmatic efforts. They could have started with that policy, but I really don't think that they would have been as successful because they wouldn't have had those partnerships and the community really behind them. Policymakers and advocates struggle with this balance of health versus politics all the time. If you're interested in making people healthier, then you want to write and hopefully get passed a policy that will actually improve people's health as soon as possible. But you're also operating within a political process, and you need your colleagues to agree that your idea is a priority. And then ultimately, you need decision makers to help make that policy a reality. So you can't be too far ahead of where the decision makers are on health issues. So being ambitious yet feasible is really about being strategic, knowing your community, and really building demand for the change that you've identified. It's also about making sure that any policy language that you're working with is really strong from the start. We work with folks who draft obesity prevention policy language, and they often propose language that's weaker than necessary. As with any negotiation, you never want to start with your final offer. You should, start at a strong point and know where you're willing to budge if you need to weaken it a little bit in order to make it happen.
Thanks, Christine. So the next element is that the policy is financially feasible. So we find that regardless of economic conditions, PSE approaches and policy approaches really have kind of a smoother go of things and can build stronger support if they strive to be financially feasible. In fact, in light of shrinking government budgets, health advocates will likely need to be prepared to defend how policies can improve health without significant negative impacts on the local economy. Now, we recognize that this is definitely a challenge, and this is where it really becomes important to have different partners within government and others who can really help you think creatively about how to create PSE approaches that really kind of maximize benefits and minimize the cost or the impact on the economy. So we generally describe 4 different strategies to ensure that policies are financially feasible. One is you can have a policy that is low or no cost. You can have a policy that uses existing funding streams. You can have a policy that actually saves money, or you can have a policy that generates revenue. We're not going to go through all of these examples, but we'll describe a couple of case studies that utilize these principles. So one great example that I think many people on the call will be familiar with is programs and policies that increase utilization of federal food programs such as SNAP and WIC. So again, with SNAP in particular, since it's an entitlement program, people who are eligible for the program should be receiving benefits, or else a community is leaving money on the table. Now there's a number of reasons why people who are eligible aren't enrolled, but there are programs that are really starting to make a dent in ensuring that people have access. So you may be familiar with the utilization rates of SNAP. Across the country, about 75% of people who are eligible for the program are actually enrolled. In California, it's much lower than that. Only 55% of eligible people are part of the program. This means millions of dollars in lost revenue that could support access to healthy food and bolster our local economy. So one great example funded by the Network for Healthy California through their African American campaign is in Fresno California, where local health advocates worked with Quickaroo, a chain of convenience stores in the Central Valley, to help it accept EBT and SNAP. So not only did they help them put into place the systems that allow them to accept these benefits, they also supplemented that with educational and nutrition outreach programs to ensure that people knew about SNAP and WIC and how to enroll, and also so they know how to use the benefits to buy healthy food. Another great example that we see around the country is joint use agreements, which typically grant access to public spaces for diverse community uses. They're a great example of an approach that can actually save money by making smart use of existing resources. For example, in Pixley in the Central Valley, the school district signed a joint use agreement to give public access to its school grounds after hours. This now means that people can access the recreational facilities, and nonprofits and businesses can rent spaces, generating a modest source of revenue for the district. Now Pixley youth can access the school soccer field and basketball court, and adults can go there to walk and jog. Here is a ballet folklorico dance group, which is just one example of a nonprofit that has benefited from the policy.
So another key component of implementing a strong policy systems and environmental changes is to start thinking about implementation and enforcement before your idea becomes a reality. So let's look at an example of thinking about who will implement a policy or other strategy. You want to make sure that it's very clear who is going to be implementing it in order to be successful. So for example, farm-to-school programs and policies are gaining popularity around the country. It seems like a simple idea. You make it easier for a school district to purchase food from a local grower. However, it's not so easy when you get into the implementation details. Many schools are no longer equipped for preparing fresh foods, and many food service workers are no longer trained in fresh food preparation. So school districts need to involve the food service director in planning for farm-to-school so that a farm-to-school policy or other program that's set up doesn't just sit on a shelf or fail because no one thought about how it was going to be implemented. New York City has been working on a range of policy, systems, and environmental changes to improve nutrition in their school food environments. When they set their sights on working to improve school food, they quickly realized that they would need to work closely with nutrition services to find some workable solutions. They wanted to increase the purchasing of locally grown produce, but they are working with a system that serves nearly 900,000 meals per day. So they couldn't just have a farmer drive up to a school with his pickup truck and load some vegetables onto the loading dock. So they conducted a detailed assessment of their current food service practices. They did taste tests with students to identify new menu options that they would enjoy. And they worked really closely with local farmers to find produce that would work within such a big system. If your institution or an institution that you're working with on a policy system or environmental change doesn't have resources for a really strong implementation plan, think about how you can scale back those changes or have a phased implementation so that you're really setting up whatever your initiative is up for success from the beginning. Strong implementation is also about enforcement. So you need to think about how a proposed change will be enforced. One promising approach is to build on existing regulatory mechanisms in order to ensure that your policy idea will be enforced. So let's look at, for example, improving child care nutrition. You could add requirements that improve nutrition to the requirements for child care licenses. So California is currently considering a proposal to require licensed child care providers to get an hour of childhood nutrition training as part of their licensing requirements. The use of an existing well-developed licensing scheme eases the implementation burden, and it means that existing enforcement mechanisms can be used, and therefore it's more efficient, and you're sort of tagging along with a system that's already working well. So we're about halfway through, and we wanted to take a pause here and hear from you again. So think about the policy change that you identified in our previous food for thought question, and type into the chat box some potential partners who could really be a good help on implementing a policy system or environmental change approach. So type those in, and we'll read them out. All right, so I'm seeing suggestions for working with local school districts, community action agencies, local library, I love that idea. Local business owners are really good supporters for both physical activity and nutrition initiatives. Food policy councils, that's a great place to find a lot of different stakeholders for a food system. So if you're working on some kind of nutrition initiative and you don't have your food policy council on board, go find them and see what they think. Beauty salon, great idea. Churches and other faith-based institutions. The farmers market associations, if you're in a region that has a lot of farmers markets, then there's probably some associations that will be a good entry point for those individual farmers markets. Great. You guys have some really good ideas for this. And partnerships have come up throughout the beginning of this presentation, and you're going to hear from us some more about partnerships throughout the rest of the hour. And while you're using the chat box, don't forget to type in questions, and we'll hopefully have a few minutes at the end to answer those. So going back to our 8 elements of a strong prevention strategy, you want to make sure that your ideas are legally feasible. Now, this may seem like a no-brainer, but it's actually more complicated than you might think. So if challenged in court, most basic business and land use regulations would be subject to what lawyers call the rational basis test. It's basically a smell test. Does the government have a plausible reason for enacting the law? Now sometimes policies that sound illegal are just politically edgy. For example, an ordinance banning new fast food restaurants or an ordinance requiring smoke-free apartment buildings have a good chance of surviving a legal challenge, even if the political stars aren't aligned. Now, on the flip side, some policies that seem like no-brainers do actually raise legal problems. For instance, communities that want to ban just tobacco advertising will run up against significant First Amendment issues. And I should note, ChangeLab Solutions is not disparaging any brands according to the network's unallowable guidelines. Just need to throw that in. Now, most people know that the First Amendment was designed to protect your freedom of conscience, your right to say nasty things about your elected representatives, your right to express yourself artistically without having to worry about government censorship. But it's less commonly understood that the same First Amendment also guarantees the right to advertise, or to use the technical legal term, the right to make and receive commercial speech. This means that cities can't ban advertising based on the content of the advertising, which includes, based on the specific type of product that's being advertised. When you hit a legal roadblock like the First Amendment restrictions, First Amendment challenges to restrictions on marketing, it's important to remember that you have a lot of other strategies at your disposal that you can pursue in order to advance your goals. You might not be able to require store owners to remove specific types of advertising, but you could certainly work with youth and other community partners to develop innovative social marketing campaigns to help drown out the negative messages. Like in this picture, we have some Philadelphia middle schoolers who are promoting water and other healthy snacks at their local corner store. The other takeaway from the legal feasibility issue is to, if you don't already, build a relationship with a local city attorney or county attorney, or even just a local attorney who's in private practice who is really behind the types of work that you're doing. They can help you assess what's possible and help make sure that whatever strategies you use aren't going to run afoul of the First Amendment or other laws.
The next element, I think, is kind of a no-brainer for this audience because it really is kind of one of the core values that I think many bring to their work. And that is that health prevention strategies and PSE approaches really should address health disparities. Since low-income communities and communities of color are plagued by disproportionately high obesity rates and other health disparities, it makes sense that strategies should address these disparities as kind of a core goal. So how we do that in practice will depend a lot on local context, community needs, and data. So one great example of a community that is doing just that is in Cleveland, Ohio, where they've recently overhauled their policies and their systems to create environmental changes that improve access to urban agriculture. So they had health disparities in mind when they decided to overhaul their zoning policies and incentives to better support urban agriculture efforts across the city, and particularly in the neighborhoods facing the greatest health disparities. They conducted an inventory that found that 18,000 vacant parcels exist throughout the city that might be suitable for urban agriculture operations that increase access to healthy food and also provide meaningful educational and economic development opportunities for residents. So the policy that they created at the city to make this change happen was they overhauled their zoning code to create an urban garden district zone with the goal of making sure that there are community gardens within walking distance of every resident, which they defined as 1/4 of a mile. They also wanted to include an affordable water policy to make sure that urban gardens and farms could access utilities. They created a land bank process for urban greening projects. And they also thought about long-term leases and land tenure to support urban agriculture. So this has been part of kind of a multi-year effort to increase urban agriculture throughout the city that included working with diverse community and health partners to really think about how to target specific communities where health disparities exist. So as part of this process, they also did things like community mapping, where they mapped the existing locations of community gardens and urban farms, as well as locations of supermarkets and places to buy healthy food. So this has really helped to drive kind of their priorities as they develop their planning process and then start to implement the zoning change. Another great example of a setting where a PSE approach could really address health disparities is in after-school programs and policies. Since low-income youth and youth of color are less likely to participate in private after-school classes and programs, strategies for after-school and daycare settings in public schools and public settings really can have a targeted impact within these groups. To give one example, the program pictured here is called Catch, and it matches volunteers from senior centers with after-school programs in San Diego and Los Angeles, providing not only education in physical activity and healthy living, but also opportunities for intergenerational mentorship. Here's another great example from Montebello, California, where they have worked to improve the health of underserved populations by improving access to healthy food after school. Montebello is a medium-sized suburb with a student population of around 34,000, of which about 75% qualify for free and reduced price school meals. FRAC, the Food Research and Access Center, recently profiled the school district for its successful efforts to increase access to healthy food outside of school hours. The district leveraged funds available through the Child and Adult Care Food Program, which is a federal food program. The district is required to meet nutritional guidelines set forth by the USDA to receive reimbursement for the food they serve. Their program now includes an after-school snack program, which has about 1,300 children enrolled at 15 after-school programs, and a summer food program, which has about 2,300 children at 15 sites during the summer, 12 of which are at schools and 3 of which are at parks and rec sites. And if you go onto the FRAC website, they discuss some of the challenges and sort of best practices that they've learned throughout their process of working with really diverse partners to ensure that these programs happen. Another fantastic resource for those of you who are interested in adopting a PSE approach in after-school settings, the California After-School Network has a range of documents, case studies, and resources that they've developed in partnership with the Network for a Healthy California. So you can find those at www.afterschoolnetwork.org. Another couple sets of resources that are applicable not only to after school but just the school environment more broadly, we wanted to highlight resources that help communities create and implement a successful local wellness policy. So we have a resource on our website called How to Enforce a Wellness Policy, and we've had people in our office work with communities around their wellness policies to take a look at the goals and implementation measures that are contained within. And on the left, there's another resource that we wanted to highlight, which is called the Wellness Policy Tool from Action for Healthy Kids, which also goes through the steps of creating and implementing a strong school wellness policy. The next element is maybe a little bit harder to pin your finger on, but hopefully when you have a strong PSE approach, you're really thinking about how to change people's expectations and how to change the conversation around health. So when we talk about population health, we often hear that individual choices, not policies, will fix the problem. We focus on one person rather than looking at the environment in which we live and that influences our health. So a strong PSE approach will start with a conversation about what residents can expect from their community and from all of the systems and environments within. It will help people question long-held norms and beliefs about the way things are. One great example of this is in the workplace setting. So traditionally, outside of the workplace, companies have not really considered themselves responsible for their employees' overall health and well-being. There were programs around workers' compensation and just making sure that they're covering their liabilities. But in terms of community, or in terms of employers feeling responsibility for their employees' health, this is a relatively new concept. However, as medical care costs rise and more employers are starting to see the importance of supporting a healthy and productive workforce, we're starting to see more companies kind of enter this field. And this can both improve company morale as well as cut costs. So in California, Lundberg Family Farms is one such company which worked with the Network for a Healthy California for information and technical assistance on developing healthy workplace policies. Of their entire 180-person staff, the majority of workers are engaged in production. So they are doing things like processing and farming and packaging, and really kind of in very physically active jobs that have a number of risks. Nearly 30% of these workers are minorities, primarily Latinos, and the majority possess a high school diploma or a GED. So in addition to competitive wages and medical and retirement benefits, Lundberg Family Farms has an impressive workplace wellness program that they've developed over time that includes a range of activities such as encouraging walking breaks throughout the day, hiring an ergonomic trainer to teach people about stretching routines, providing vending machines on site with healthy options so that there's increased access to healthy food, offering daily distribution of free fruits and vegetables to employees, providing reduced gym membership, adopting an illness and injury prevention plan, and providing regular trainings, and so on and so forth. In 2010, 95% of their workforce underwent a first-time health risk assessment screening conducted by an outside insurance agency, and employees had an incentive to participate through a discount in their insurance costs. So they've had this program in place for a few years now, and they're starting to see results. They've seen employees reduce their blood pressure, cholesterol, and glucose levels. And many more have made significant lifestyle and behavior changes by eating healthier and being more physically active. For those of you who are working in worksite wellness, the Network for Healthy California has some fantastic resources on their website at the worksite program California Fit Business Kit. Available on that website, there are fact sheets on how to create a worksite wellness committee. There are sample policies for healthy meetings, vending machines and dining facilities. There are recommendations on creating farm-to-institution opportunities, and there's information on healthy stairwells.
All right, so we're in the home stretch here, and the final element is that a strong prevention strategy should be part of one piece of a larger puzzle. You might be wondering, is opening up schoolyards through joint use agreements really going to make sure that every child gets enough exercise every day? Will healthy vending machines really decrease obesity rates across the country? The answer to these questions between you and me in this very private forum is no. If you consider each policy in isolation, there's not a single policy that by itself will completely reverse the obesity epidemic. Each obesity prevention policy will chip away at the problem and hopefully result in small declines in obesity rates. When we look back over time, though, we'll see a healthier population and healthier places to live that make it easier for residents to make healthy choices. But we can't expect all of this to happen with one policy overnight. So our final message to you is to be patient and to frame the issue of improving nutrition, increasing physical activity for your communities as ones that require a long-term commitment, not a short-term fix. One community that has really taken this idea of having a larger plan for a healthy community to heart is Baldwin Park, California, and their Healthy Baldwin Park initiative. This has been an initiative many years in the making, and throughout those years they've had a lot of PSE successes. They've passed a range of policies, from joint use agreements that are opening up schoolyards for the community to use after school hours, to bicycle and pedestrian policies, to smoke-free environment policies. They've also are a leader in healthy corner store programs, so programs that offer incentives to corner store owners for adding healthy products to their shelves and making other improvements. These are classic environmental change strategies. And one of the reasons for their great multi-year success has been their partnerships. They have the People on the Move Coalition, which is this very broad-based coalition that includes youth, other residents of the community, Kaiser Hospital System, city staff, the Los Angeles County Department of Public Health, and the school district. And those partners have, learned to work together over the years and have really collaborated to create a holistic plan to improve health and reduce obesity in Baldwin Park. So with that, these are the 8 elements of a strong prevention strategy. And as Livia noted in the chat box, we will be sharing this presentation in PDF form tomorrow over email. So if this is a really nice, you can think of this as a checklist to use when you're thinking about different strategies you might use in your community. And Change Lab Solutions has a wide variety of resources for you to use in your policy system and environmental change work. One that or a couple we want to point you to now. One is a model obesity prevention resolution. This resolution is a good way to lay the groundwork for comprehensive action on childhood obesity prevention in a community. It lays out the issue in your community through the first section with data, and really articulates why childhood obesity is a local concern. And then it directs agencies in a city who passes this, or community that passes this, to take different actions to study the problem from their perspective. So directing, say, the planning department to look at different barriers in the zoning code for healthy food access and active transportation. It also establishes a task force to study obesity disparities in the community and to really make sure that reducing those disparities is at the forefront of any comprehensive obesity prevention plan. The other resource is another resolution. Resolutions are often a really good first step towards stronger action. This is focused on food systems. So this is a model healthy food system resolution. And it identifies a number of actions that local government and their partners can take to make every step of the food system healthier, from food production to waste disposal and everything in between. It allows a city council or other legislative body to articulate a community vision for that healthy food system from the nutrition standpoint, but it also gives ideas for how to incorporate other considerations like environmental aspects of food production and waste disposal. And if your community does not have a food policy council, it provides language creating a food policy council who could really drive forward healthy food system changes. So I hope that we have inspired you and given you a lot of ideas for different policy, system, and environmental changes that you might pursue, and a way to assess them for how strong they are from a public health perspective. And as we said at the beginning, this is the first of several webinars that will get more deeply into different PSE areas like nutrition and physical activity. If you have questions coming from this presentation, please contact your program manager or Betty Sun or Lisa Tadlock with the state. And with that, we have just a few minutes for questions. So if you haven't typed any questions in, this is your moment for us to answer them. While we're waiting for any questions, I did see one very early on, an audience member was interested in the Fresno farmers market zoning changes, and they were wondering when Fresno got their first farmers market as a result of those changes. And the initiative to change the zoning code began in 2007, and the final zoning changes were approved in 2008. And from what I can tell, the first farmers market was opened in Fresno sometime later in 2008. So it did take some time, but now if you just Google Fresno farmers markets, you can see that there are tons of farmers markets there now, and that all stemmed from the zoning ordinance. So Lisa, I think in our final minutes we've got a great question for you. Someone wants to know, what are some effective strategies for transforming a privately owned vacant lot into a community garden? And how could a city council help with this process?
Sure, that's a great question. So I think this kind of theme of partnerships that we've heard throughout this discussion is really relevant here, because particularly when you have private land, there may be kind of a little bit less leverage that the city can play in terms of having the owner really engage in urban agriculture, but there are still incentives and other ways that you can kind of create those partnerships. We actually have a couple of resources on our website really geared towards urban agriculture and community gardens, and we are happy to send those out as links afterwards, and there is going to be a webinar later in the series about urban agriculture. But really taking the time to do that assessment process where you figure out, okay, is this a good piece of land in terms of access, in terms of, are there people who are really able to take on responsibility over the land and taking care of it? Does it have utilities? That's kind of the first step, right? And then there's also the assessment piece of trying to get a sense of whether or not that landowner is really amenable to the idea of granting access to their land. Once you kind of lay that groundwork, then you can start to think about the next step, which is really developing some sort of agreement. And during that agreement process, ideally you'll have a lease or some sort of other formal document that really outlines the responsibilities and kind of what each party agrees to commit to and what they receive in return. So that is definitely a great PSE strategy that really gets to most of the elements that we have outlined today. And then, to just kind of talk about the City Council role in that. They definitely can play, the role of providing leadership and really trying to change the conversation around how private land gets used. They don't have they may not have direct authority to say you need to open this land to the public, but there's other ways that they can influence that process.
And I would just add that my husband is doing some work in our community to try to improve the built environment, and we've found that our city council member is really good at bringing private business owners or private landowners to the table for even just a conversation. So even just using their little bit of a bully pulpit to get people to chat with you about your idea. So we're out of time, and I really want to thank you all for your attention and for your questions and engagement with our different food for thought questions. Good luck with your work, and we hope to see you on our next webinar. So have a great afternoon.